My name's Fiona. I'm a speech pathologist. I've been working as a speech pathologist for just over 30 years. Genevieve was 3 when I first saw her. She'd been to 2 other speech pathologists and she'd been diagnosed with a condition called Verbal Dyspraxia. It's a condition where children know how they want to move their mouths, but they just don't know how to make their mouths do it. They're completely unintelligible. They cannot be understood and they cannot make their needs known. She actually was the most severe child that I've ever seen. So at the age of 3, she had 5 sounds. She had and b, and she had a couple of vowels, and I know she had 1 other consonant. I told her family that she would need from about, say, somewhere between 2 and 5 years of weekly speech therapy. I saw Genevieve for about 7 sessions, and in 7 sessions, Genevieve's progress was very, very slow. So it took her a long time to learn a sound. It took her a long time to be able to, say, put her lips together to say p, which to us seems like such an easy thing to do, but for Genevieve that took her many weeks to do. Another child had come to me, referred to me by Janine. When I started working with him, he started to make improvements that I couldn't explain by the speech therapy alone. His progress was too fast and he was picking up things that speech therapy, what I was doing, just wasn't teaching him to do. And so I wondered if maybe Genevieve might have some improvement with Bowen Therapy as well. What happened with Genevieve was that she went 4 times, and I recorded after each of those 4 times, I recorded what changes I was seeing, and I was seeing some quite fascinating changes, some that she was finding sounds easier to say, that she was starting to learn sounds that I hadn't taught her, but she was just spontaneously making them. And for her, the 4th session was her turning point. Her mother had told me that there had been this extraordinary change in Genevieve's talking, but I showed her some toys that I had, and one of the toys was a little yellow duck that had plastic sunglasses. And she said to me, "The little duckie's got sunglasses." And she said it to me in the most perfectly pronounced speech, that she said every single sound. And the words that she said, like sunglasses, in speech therapy for a 3-year-old is actually quite a tricky word. So she had all of the speech sounds and she had the grammar and the length of the sentence that told me she'd made an extraordinary, miraculous improvement that I couldn't explain. 6 months later I came back and Genevieve was the most talkative, fun, confident, happy child with sentences that maybe were like 10 words long. She could understand everything. She could have a totally normal conversation. Her language was actually more like a 5 or 6-year-old in terms of what she could understand and the way that she could communicate. The results that I've seen have been so rapid. To be honest, I would recommend any child who has any kind of speech difficulty, whatever the cause, whether it's verbal dyspraxia or any other kind of speech sound disorder, I would refer anybody for Bowen Therapy. But every child I've seen who's gone to have Bowen Therapy has made an improvement.